Today we are going to talk about pregnancy, the stages, and threats. Cycle of pregnancy. Pregnancy is a challenging yet miraculous process that unfolds over approximately 9 months, involving a series of stages. It's important to me as my mom gave birth to me and wanted to learn more about the whole process of life. From the beginning of the stages to childbirth, the pregnancy journey is marked by continuous growth and transformation in a woman's body. Understanding the pregnancy cycle, including the main key milestones and changes that occur during each trimester, offers valuable insights into how new life develops and prepares for the world outside the womb. Fertilization. The process starts when a sperm from a male fertilizes an egg from a female. This happens in the fallopian tube. Implantation. The fertilized egg travels down to the uterus and attaches itself to the lining of the uterus. This is when pregnancy officially begins. Embryo development. The zygote develops into an embryo. The embryo grows and its organs start forming. This stage lasts until about the 8th week of pregnancy. Fetus development. After the 8th week, the embryo is called a fetus. During this time, the fetus continues to grow and develop, with all major organs forming and maturing. Growth and maturation. The fetus continues to grow inside the womb, developing its organs and gaining weight. This stage lasts from the 9th week until birth. Labor and delivery. Around 9 months, when the baby is fully developed, the body prepares for childbirth. Labor begins, and eventually the baby is born. The 9 months of pregnancy are divided into 3 stages, or trimesters, each with distinct characteristics in terms of mother's experiences and fetal development. Symptoms and signs of pregnancy. Pregnancy is an unforgettable journey that brings about a variety of changes in a woman's body. As early as the first weeks, many women begin to notice a range of symptoms and signs that signal the onset of pregnancy. These early indicators, which can vary widely from one woman to another, are the body's way of adapting to and supporting the development of new life. Understanding these symptoms can help women recognize and prepare for the changes ahead. This can include symptoms and signs like feeling faint, headaches, lower abdominal pain, cramping, food cravings, sensitive of smell and appetite changes, mood changes, urinating frequently, sense of tiredness, dizziness, tender, swelling, sore, tingling breasts, spotting, light bleeding, morning sickness, usually nausea or vomiting. Threats during development. During pregnancy, there's some concerns several threats to a baby's development, which can affect the growth and health of the baby. Here are some key risks. 1, 2, 3. Poor nutrition. Inadequate nutrition can lead to low birth weight, developmental delays, and other health problems for the baby. Substance use. Smoking, alcohol, and drug use during pregnancy can cause birth defects, premature birth, low birth weight, and developmental issues. Infections. Certain infections like rubella, toxoplasmosis, or sexually transmitted infections can harm the baby, leading to birth defects, developmental problems, or even miscarriage. 4. Environmental toxins. Exposure to harmful chemicals, pollutants, and radiation can negatively impact the baby's development, causing birth defects or other health issues. 5. Chronic health conditions. Conditions like diabetes, high blood pressure, or thyroid disorders in the mother can affect the baby's growth and development. 6. Stress. High levels of stress during pregnancy can lead to complications such as preterm birth or low birth weight, and may impact the baby's long-term health. 7. Medications. Some medications, if taken during pregnancy, can cause birth defects or developmental problems. It's important for pregnant women to consult their healthcare provider before taking any medication. 8. Genetic disorders. Some babies may inherit genetic conditions that can affect their development, leading to conditions like Down syndrome or cystic fibrosis. 9. Physical trauma. Severe injuries or physical trauma to the mother can affect the pregnancy and the baby's health. 10. Inadequate prenatal care. Lack of regular checkups and monitoring during pregnancy can result in undiagnosed issues that could affect the baby's development. Maintaining a healthy lifestyle, attending regular prenatal visits, and avoiding harmful substances are crucial for minimizing these risks and supporting a healthy pregnancy. Childbirth before, during, and after. Physical changes. the mother's body undergoes various changes, including weight gain, breast enlargement, and hormonal shifts. The uterus expands to accommodate the growing baby. Health monitoring. Regular prenatal visits help monitor the health of both the mother and baby, including ultrasounds, blood tests, and measuring the baby's growth. Preparation. The mother prepares for childbirth by learning about labor, creating a birth plan, and possibly attending childbirth classes. Growth and development. The baby develops from an embryo into a fetus. Major organs and systems form, and the baby continues to grow, gaining weight and strength. Movement. The baby begins to move, and the mother may feel kicks or shifts as the baby gets bigger. Positioning. Towards the end of pregnancy, the baby typically moves into a head-down position in preparation for birth. During birth. Labor. Labor involves contractions of the uterus, which help to gradually open the cervix. This stage can last for hours, and it's divided into 3 phases: early labor, active labor, and transition. Delivery. Once the cervix is fully dilated, the mother begins to push, helping the baby move through the birth canal. This ends with the birth of the baby. Afterbirth. After the baby is born, the placenta, which provided nutrients and oxygen to the baby during pregnancy, is delivered. Birth. The baby is born through the birth canal or via a surgical procedure called a cesarean section. First breath. After birth, the baby takes its first breath and begins to cry, which helps clear the lungs of amniotic fluid. Initial health check. The baby undergoes an initial health assessment, often called the Apgar score, which checks heart rate, breathing, muscle tone, reflexes, and skin color. After birth. Physical recovery. The mother's body begins to recover from childbirth. This includes healing of the uterus and perineum, hormonal changes, and the start of breastfeeding. Emotional changes. The mother may experience a range of emotions, from joy to postpartum blues or even postpartum depression, which should be monitored and addressed if necessary. Bonding. The mother bonds with the baby through skin-to-skin contact, feeding, and caring for the newborn. Newborn care. The baby requires regular feeding, diaper changes, and sleep. Regular checkups monitor the baby's growth, weight gain, and development. Bonding. The baby bonds with the mother through touch, voice, and feeding. Development. The baby's brain continues to develop rapidly, and they begin to respond to their environment, such as recognizing voices and faces. Newborn stages. 1. First week. Adjustment to life outside the womb. The newborn adjusts to breathing air, feeding, and regulating body temperature outside the womb. Feeding. The baby begins to feed, either by breastfeeding or formula, and may feed frequently. Sleep. Newborns sleep a lot, typically 16 to 18 hours a day, but in short bursts. Reflexes. Primitive reflexes, such as the rooting reflex and the Moro reflex, are present. Bonding. The baby starts bonding with parents through touch, voice, and eye contact. 2. Second to fourth week. Feeding and growing. The baby continues to feed frequently and may begin to gain weight rapidly after initial weight loss in the first days. Awareness. The baby becomes more aware of their surroundings, responding to sounds and starting to focus on faces, especially close-up. Movements. Movements are mostly reflexive, but the baby may start to show some intentional movements like bringing hands to the mouth. Sleep patterns. Sleep continues to be in short periods, but there may be slightly longer stretches at night. 3. 1 to 2 months. Social smiling. The baby may start to smile in response to faces and voices, a sign of early social development. Improved vision. Vision improves, and the baby may begin to track objects with their eyes. Increased alertness. The baby spends more time awake and alert, interacting more with their environment. Head control. The baby begins to gain some control over head movements, though support is still needed. 4. 2 to 3 months. Strengthening muscles. The baby's neck muscles strengthen, allowing for better head control. They may also start to push up during tummy time. Cooing and vocalization. The baby begins to coo and make other sounds, an early form of communication. Recognizing parents. The baby starts to recognize and respond more to parents and close caregivers, showing excitement when they are near. Hand movements. The baby starts to bring hands together and may begin to grasp objects, though coordination is still developing. 5. 3 to 4 months. More active and engaged. The baby becomes more active, enjoying playtime and interacting more with people and objects. Rolling over. The baby may start rolling over from tummy to back and vice versa. Laughing. The baby might start laughing, responding to tickles, funny faces, or sounds. Better sleep patterns. Sleep patterns may start to stabilize, with longer stretches at night and more predictable naps.